To support this sort of quality programming, go to our website, wvpubcast.org.
Support for Outlook is provided by the following. The National Science Foundation's West Virginia Experimental Program to stimulate competitive research, investing in West Virginia's future by building infrastructure for scientific research. On the web at wvresearch.org.
On this Outlook, West Virginia's oral health. In Martinsburg, a 2-day clinic gives free care to anyone willing to line up and wait.
I'll put it this way, I have a split tooth right here in the front.
In Wyoming County, 2 dentists who take Medicaid struggle to treat 12,000 patients.
It's good because there's a lot of them that won't, and it's just financially it's hard to come up with the money to pay for it. So it means a lot, for someone to actually take the insurance.
This is Outlook, a reflection of our place, our time, and our people.
Well, we got here about 3:30. Well, I'll put it this way, I have a split tooth right here in the front. So it's been going bad for quite some time.
Well, it's been a couple of years. They're down there to where they really need to come out. They haven't started hurting or anything yet, but it's, it's time. They need to come out.
Different, some root canals, some pulling, some cleaning. I have no idea right yet.
Well, I've had them for 62 years, so we get them out of there.
I got a real bad tooth I've had for about a month, real bad toothache.
Thousands of West Virginians are living with debilitating dental pain. According to the Centers for Disease Control, West Virginia ranks last in oral health. The reasons vary. Dental care is expensive, often not available, and a surprisingly large number of people don't know how important it is to take care of their teeth. But there are many working tirelessly to better these statistics and to overcome cultural bias to improve West Virginia's oral health.
So good morning. Good morning. So it is 5:58. We're opening the doors in 2 minutes. When you come through the door, you come in 10 at a time.
Not a patient, right? No, ma'am.
Times are hard.
Okay. I've got a real bad tooth, and I need to try to get it pulled. It's a back tooth, so I want it out. And sometimes it hurts so bad, I just cry. I suffer with it day and night.
Deal works at a nursing home. She has health insurance but chose not to buy the dental coverage offered by her employer.
I thought I'd just take the cheapest way out, because everything's so expensive, and I wanted to make sure I could afford it. My daughter went a few weeks ago, and even with dental insurance, it was really high, But with me not having it, I said right now I just can't afford it, so I couldn't go.
Deal is one of about 1,200 who were treated at the Mission of Mercy. During 2 days in June, Hedgesville High School turned into an emergency clinic where 60 dental professionals and more than 700 other volunteers gave free care to anyone willing to line up and wait. Patients can choose one service: a cleaning, filling, fluoride treatment, denture repair, or partial denture.
I guess you could call it organized chaos. Lots of things happening, but it's very organized. The first thing they do is come in through patient registration, and they'll get a wristband so that we know that they are the patient, and then a lot of folks bring their family or a friend to be with them, their hand holder people, and we put wristbands on them so that everybody at the mom either has a neck name tag or a wristband.
Hi Diane, how are you this morning?
Okay.
So you're a cat person?
Mm-hmm.
good. I like a cat.
I have
too.
one.
One.
She doesn't like other cats, so I can only have one.
What's her name?
Zoe.
Zoe. Oh, is she older, younger?
She's about 4. It's a calico.
Oh, how pretty. I have one that's 16.
No.
Are you on blood thinners?
No.
Do you have diabetes?
No.
Any in your family?
Yes.
And you want to hold that there. You have to wait a minute.
I got to learn how to do that because my brother, one of my brothers, has just found out. I guess his sugar's real high. Morning. In here?
Sorry. Yep, please have a seat. This is called triage, and after the patients have already been through registration and medical screening, so we know that they're healthy enough to have work done today, this is the area where they'll first sit down with a dentist that will help them decide what procedure will be done today. We have the option of cleaning, a tooth pulled, or a filling. Most patients, or a lot of patients, have multiple problems, so what we're trying to help them decide is what's the most important thing they want done today, because we can't do more than one procedure. Sometimes they may not even know what's wrong. I've not been to the dentist in 10 years, so we might just take a quick look and say, hey, did you know you have a cavity back here? Would you like that filled today? It's kind of the decision-making area as to then what will happen next.
What can I do for you today, Diane?
I've got my very last tooth has got a great big hole in it, and it just sets me in a fit all the time, you know.
Is it sensitive to hot, cold, and that sort of thing?
Yeah, and then just sometimes it just hurts no matter what.
Yep. And how long has it been doing that?
Quite a while. The worst probably for the last month has gotten really bad, you know.
Yeah, that tooth has a big cavity in it, right along the gum line there. And I don't believe there's any way they can fix it, fill it. So about all they could do for you is remove it. And I think that's what I would do if it were me.
Yeah, that's what I want.
Most of the people who come to the mom are like Diane and need to have a tooth extracted. Volunteer dentists and oral surgeons took out about 1,700 teeth during this 2-day clinic. Tooth loss is common, especially in West Virginia, which has the highest rate in the nation. The Centers for Disease Control does a national oral health survey. It shows about 20% of U.S. adults over age 65 have lost all their teeth. In West Virginia, it's about 43%. Nearly 70% of West Virginians have lost 6 or more teeth after age 65, compared to about 46% for the nation.
The mom is a wonderful thing. The mom, we see 1,000 people or a little more than that a year, but it's a Band-Aid. That is just, we're doing that just because that's all we could do.
It's that one.
Yep.
The gold one.
Yep.
That thing back here.
Yeah, the back one.
And the one on the wall in the back.
So that's a wisdom tooth, yeah.
While the free dental clinic gives some folks much-needed care once a year, in rural Wyoming County, Dr. Mike Moore is on the front lines every day, dealing with toothlessness and other oral health issues facing West Virginians.
And Dr. Moore has an opening coming up in October. Would you be available to bring her in?
Moore's office has about 12,000 patients.
I'm here to kind of help people figure out how to do better with their oral health care, and we do a lot of that, but to give an honest assessment of the oral health of the population I serve, I would have to say it's poor. High incidences of periodontitis, gum disease, high incidences of caries and tooth loss from that, high incidences of rampant caries at a young age. Caries is just cavities, just decay, tooth decay, and we see just very, very high incidences of dental disease of all types. Let's go ahead and pull up Dylan there, and let's see what you're going to do to him today.
Moore is from Braxton County and practices with his wife, Dr. Michelle Brown. She was raised here in Oceana and sees only children.
Yeah, I looked at the X-ray, that one, I can see the one that it probably is you wanting to have taken out.
Yeah,
Okay.
because it felt to me like that's the one, but when it would go to her, it was causing teeth up here plus teeth down here, and I mean, it was bad, but I could tell it was coming from just that one tooth.
Moore estimates that half his patients and 80% of Browns are on Medicaid. The program covers full dental care for the low income up to age 21, but after that it only pays for checkups, x-rays, and extractions.
Feeling okay?
Jennifer Morgan travels 80 miles round trip for dental care here because Moore's office will accept her Medicaid insurance.
Stay right there in your seat. Team's going to go over some rules with you and get you some extra gauze. Thank you very much.
Thank you. It's good because there's a lot of them that won't, and it's just financially it's hard to come up with the money to pay for it. So it means a lot, you know, for someone to actually take the insurance. So it's helpful. Yeah.
The fact that Medicaid only covers extractions means they end up getting only extractions once they turn 21. And we try to be very proactive with our patients in that way. If somebody just comes in for a toothache and they're 20 and we know they're going to have Medicaid, we say, look, you have an opportunity that Medicaid's going to cover some stuff here. And we want to make sure they understand that so that they're not left out in the cold once that 21st birthday comes. But the limitations of the coverage definitely dictate the course of treatment for a lot of people.
Amy Anderson travels from Logan County with her daughters.
Come over here, Tammy. Wide as you can. Sit that down all the way. Hard to carry around. Oops. Can you turn your head that way just a little bit for me? Thanks. Is it really, 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 really still? Alright, so you open really big. Fight. Close. There you go.
It was hard with my oldest one's teeth. She had a lot of work that had to be done, and it wasn't covered through most dentists, and it was coming out of my pocket, and it was just really hard to have to pay for all that. And then I found this dentist through my sister, which she comes here, and she talked really great about them and said that everything her kids needed done, the medical card paid for.
The West Virginia Dental Association says about 600 of the state's 800 dentists see patients on Medicaid, but the majority see only a handful a year. Most are forced to limit the number they treat. Moore says accepting as many of these patients as he does means an overwhelming workload and often a financial loss for his practice. Medicaid reimburses at less than half of what Moore charges, and the program hasn't increased its rates since 1991.
For some Medicaid procedures, if you take into account our overhead, we're actually losing a little bit of money. Not on every Medicaid procedure, but on a few of them. If Medicaid was reimbursing at a rate anywhere north of where they are now, I think you would see a few things. You would see more dentists willing to accept it, which would increase access. You would see more new dentists willing to step into rural areas that are mostly Medicaid. And I hear all the time that those are two big issues. The solution to that issue is easy. Increase the Medicaid reimbursement.
For example, Medicaid reimburses a dentist $44 for removing impacted wisdom teeth, an operation that normally costs between $120 and $150. While Medicaid provides limited coverage, Medicare, the national health insurance for seniors, offers none.
I see people who probably, if they had some kind of coverage, would make probably more effort to maintain their teeth. A lot of them, once they get to that age, and part of this is that coverage. Another part is a cultural bias. Is they say, well, I'm 65 now, it's time to get them all out and get some dentures. And some of them would go and save a year or two to save up the money to get their dentures. And I make lots and lots of dentures. All this pink part is wax. This is the actual teeth. We're just going to try it in, see how the bite does, and see how it's going to look. Okay? Slowly bite down to your first touch. Okay, I'm going to have to adjust the bite on it just a little bit. I'm going to put some stuff in there and have you bite down on it to your first touch, because the bite's just a little bit off, and that way we can be sure that, yeah, it's hitting right in that spot. We want it to hit evenly all around. So. Perfect. Now, what I want you to do is just hold real still right there, okay? Now, I'm coming at you with the caulking gun. You're just going to feel me squirting this stuff up in here. This stuff will start to get solid in about 2 minutes. I'm going to keep my finger right there. You just relax, just stay closed exactly like you are. You doing okay? All right. Okay, go ahead and open. They kind of stuck together. Perfect. All right. Now, what I'm going to do is I'm going to send that back to my lab technician, and he'll reset those teeth so that we have a nice even bite. And then we'll do this try-in appointment again and make sure everything comes together okay. And then the time after that, you'll get them, so you have 2 more appointments.
Yeah, 2 more.
Yep. We want to make sure that we get it right, so we won't put any rush on it. We'll make sure that it's done just right,
Yeah,
okay?
done right. I don't want to.
Well, thank you very much.
Thank you.
Just stop up front and they'll get you set up that appointment for you.
I'll see you in 2 weeks.
Yes, sir.
But dentures aren't the panacea many people hope for. Dr. Lisa Dunn uses her father as an example.
He is the classic example of being brought up thinking that that's what happens. You know, as you get older, you're going to lose your teeth. We're all going to have dentures. His mom, his father, all of his siblings had dentures. I don't recall at what age, but at some point they all did. My father got dentures at about age 25. And he has had so many problems because dentures are great, and we do everything we can to make them fit and to function properly, but it's not the same as your natural teeth. So, for example, over the years, because the roof of your mouth, your palate is covered with acrylic in a denture, you don't have the feeling of your tongue to the roof of your mouth to tell whether food's chewed up properly. And so my dad many, many times has choked because he couldn't tell if the food was completely chewed. I've been with him to the emergency room when his esophagus, he wasn't not breathing, but it couldn't go all the way down his esophagus because he tried to swallow something too big.
And those who won't wear dentures or can't afford to buy them can only eat soft food, so they're often malnourished.
I know several people, and I'm sure there's millions of them out there, that just never either get dentures or can't function with them, and then they end up eating soup and cottage cheese and grinding things up in a food processor, which then causes poor health by you have stomach problems, you're not getting the fiber, you might get diverticulitis. A lot of very thin people that don't have teeth because they simply just give up. It's too much trouble to chew.
The main reasons for tooth loss are decay and gum disease.
If you're not brushing or flossing your teeth correctly, we find that this can lead to the first of the 2 most common types of gum disease, and that is gingivitis. And this is an infection in the gingiva or the gums that surround the teeth. And in contrast to our past picture of a healthy gum, the symptoms here are that the gums now turn red. They're not pink. Rather than being firm, they're swollen. And if you brush and floss, you could see bleeding. In this case, although you cannot see below the gums, what we would see if we had an x-ray would be that the bone is right where it should be. All the tissues look healthy and normal. But with the exception of the red gums, everything else would be healthy. So all someone has to do with this type of disease is to start brushing and flossing their teeth correctly and see their dentist.
Folks who fail to take care of gingivitis will likely end up with the much more serious periodontal disease.
We would see many times that the tissue has receded back from the teeth. If we had an x-ray, or we could look below where the tissue is, we would see that the gum has been resorbed away, eaten away, if you will. And consequently, the teeth can shift or become mobile. And by the way, shifting teeth is one of the first signs to some people that they have a problem, and they come and see a dentist or a periodontist. And you can have teeth actually fall out or need to be extracted.
Kraut participates in a study with the University of Pittsburgh through the Center for Oral Health Research in Appalachia. Families in Nicholas and Webster counties are part of the study.
In our study, where we have 441 families in West Virginia and some families in Pennsylvania, we combine those, but we found that over 80% of the adults in our two states, in our studies, have the more severe form of gum disease, periodontitis. And that is probably the highest that I'm aware of in this country.
The study looks at how genetic makeup as well as environmental factors contribute to tooth decay. While people can't do much about genetics, they can prevent or control most gum problems.
I know as a periodontist that if we can work with a patient, particularly to show them the importance of brushing well and flossing their teeth, and to look towards a good diet, that we find that the gum tissues and the decay improve.
Do you have any notice any problems or anything that you're concerned with? Okay. Alrighty. I'll just leave her sitting up. Can we see those pretty teeth? Huh? Yeah. Look, I found Dora. Uh-oh. You want to use Dora toothbrush? You like Dora? Okay.
Teaching children to take care of their teeth is one key to better oral health in the future. According to the West Virginia Dental Association, more than 50% of the state's children are covered by Medicaid, and another 10 to 15% by the Children's Health Insurance Program. Both have comprehensive dental coverage for children. In the Eastern Panhandle, Dr. Lisa Dunn treats children on Medicaid and CHIP and educates their parents.
I think it's the mindset maybe of some of the parents that, once again, it's not that they're uneducated in general. They may just not be educated on dental. And so their parents lost their teeth at a middle age. When you get older, that's what happens. We lose our teeth, we go on. I hear a lot of parents say, well, they're just baby teeth. We're going to get another set. So things like not brushing their teeth, not helping their children brush their teeth. I always ask, do you help your child brush their teeth? And I think sometimes they even take that as an insult. Well, they can brush their own teeth. I'm like, well, you really need to help them because they don't have the motor skills to get in all the spots.
We see kids sometimes 4 and 5 years old where you take out almost all of their baby teeth. We had a child come in, my partner saw this kid a couple days ago, 6 years old, had a bottle with a nipple on it with Pepsi in it, still drinking it out of a bottle. And if you don't brush, especially if you drink that going to bed, there's a problem called milk bottle caries, which is milk bottle decay, and it's from kids going to bed with a bottle with anything in it other than water, and it sits on your upper front teeth. We see a lot of kids 2, 3, 4 years old where all we take out are their 4 upper front teeth because they're all decayed off to the gum line.
Few people understood the connection between oral health and overall health until the U.S. Surgeon General released a report in 2000. That report points out that periodontal disease can lead to things like heart trouble, stroke, diabetes, and problems in pregnancy. So taking better care of teeth and gums leads to better overall health.
The mouth is not disconnected from the rest of the body, and it has a direct effect. A lot of times you can diagnose a health problem by something happening in the mouth, or vice versa.
A little bit more. There we go. Hanging in there? Mm-hmm. Okay. The tooth might break, okay, because it's all rotten on the side there. Mm-hmm.
Great job.
Good.
Very good.
Okay, got the tooth out, okay?
It's out? It's out already?
Yeah. gonna put one little stitch in there, and we're all done. That's good. You gotta get these teeth, the rest of those cleaned, okay?
I know. You've been here all day, so there's no need to rush here at the end, right?
After 24 hours open, I want you to use warm salt water rinses a couple times a day. Bite down hard, keep it right there. We're going to give you some emergency contact numbers in here in case you have any problems, along with some extra gauze for biting on. There you go. Thanks.
It takes a long time to change cultural biases, but I think they are changing. And so that's another positive. I think when all those things taken into account and people really working to try to make a difference, I feel like that's what I'm doing, is really working to try to make a difference. And I think the more people that do that, it will make a difference. And I feel like we're making progress. Just sometimes it's slower than I would like to see it, but I think we're making a difference. So.
Support for Outlook is provided by the following. The National Science Foundation's West Virginia Experimental Program to stimulate competitive research, investing in West Virginia's future by building infrastructure for scientific research. On the web at wvresearch.org.
To support this sort of quality programming, go to our website, wvpubcast.org.